African health authorities say the current Ebola outbreak in Democratic Republic of Congo is the fastest growing ever. The statement came after the World Health Organization data showed that there have been 1,759 confirmed cases in DR Congo since the outbreak was declared in mid-May. This includes 600 deaths. According to Director of the Center of Public Health Emergency, Africa CDC, the outbreak is not just the fastest growing among previous Bundibugyo outbreaks, but all the different viruses that cause Ebola. He said the deadliest Ebola outbreak in 2013 to 16 in West Africa had 994 cases in the first 6 weeks, and it compares to 1,596 in the current one. The outbreak in northeastern DRC earlier hit 4 provinces, but was focused on Ituri Province. The trial of 2 potential treatments for Bundibugyo began in the DRC on July 2. The effectiveness of the monoclonal antibody MBP-134 and the antiviral drug remdesivir alone and in combination is being evaluated.
For the Ebola response part, we need around $518 million. When we are going for the humanitarian element related to the response, more than $800 million. Both of them, we are looking for $1.4 billion to be available to support post-Ebola response.
With the Ebola death toll topping 600, orphans in Congo are struggling to rebuild life after their parents' death. According to relatives, some children were sent to an Ebola treatment center for consultation and observation, but they have returned home with a clean bill of health.
On Monday, the neighbors called an ambulance to take her away and asked my father to go with her, since he was also sick. They advised him to get examined, and he agreed to follow their advice. So they both went to the hospital. On Tuesday, at around 3 o'clock in the afternoon, we received the terrible news. Both my father and my mother had died.
Meanwhile, deportees and lawyers said at least one suspected Ebola patient was quarantined in the same Equatorial Guinea hotel where migrants deported from the US were detained. Separately, Ebola response workers in northeastern DRC staged protests outside 3 treatment centers on Thursday. They even claimed they had not been paid all they were owed for their work. Police dispersed one of the protests outside the CME. Health Minister Samuel Roger Kamba acknowledged that there had been problems with the human resources pillar of the response. An official at Africa's top public health agency said it was working with Congolese authorities to speed up payments to frontline health workers.